all of them, or do you think that your specialty over 24 years of experience, y'all may do 10 things better, and if you could find some help with somebody else doing the other 12, you wouldn't have to try to split up your time under 22 different agencies or 22 different services?
So I think that one thing that I knew early on is we had to develop our niche. And there are certain things in our niche, and that's in that behavioral health continuum. We added homelessness, and that was because it affected so many of the clients that we serve. So all of those things that made sense in the holistic care we were trying to provide, yes, we've done. But you do need really good project partners because we can't do it all. And you have to have really good resources within the community to share that responsibility if your goal is long-term sustainable outcomes. And that's my goal.
Okay. Thank you.
Good question.
Commissioner Key.
Yeah, Sarah, we got a big agenda, so make as quickly as you can. I got a couple things. You're working with the Alliance on a pilot program with over $500,000. Mm-hmm. How long is that? What is that about?
The state has decided that individuals that do not have the capacity to participate in their court hearings, typically they go to a state hospital and stay for over a year. They want that done in the community. So we do all of the capacity evaluations in this court district. For those that have an opportunity that can be restored, they've provided us that funding from the states, from DHHS, to be able to provide restorative services for them.
So you're going through the Alliance for that?
Yes, sir. They reached out to me.
How long is that program?
My understanding is that as long as there are good outcomes, they plan to continue that because that $500,000 is still much cheaper than what they're spending for the state hospital rate.
Your statistics, and I'll be honest, I don't know everything you do because you do a lot of things. Your statistics are impressive.
Thank you.
Well, but I don't know how to judge them. So
Yeah.
I just tell you that, but it seems like you have a lot of success with this, but we still have an 89% recidivism rate in our jail system.
Mm-hmm.
Why are you so much better than another program? Most of your numbers are 80+%. I find it amazing that someone who did something, a violent crime, then does nothing for years and years. I don't know how long the time is, but where's the disconnect? Where's the air pocket between your person and a jail person?
In the adult system?
Well, in today's world, a 16-year-old can be an adult, but can be in your program too.
Yes.
Right? You got an 83-year-old?
Yeah.
Who drank too much?
Yep.
Okay. Why are you so good and they're so bad?
Well, so the first thing that my staff would probably tell you is that I am very narrowly focused on outcomes, and we only use evidence-based programs. And I guess I'm a little strict on, we're going to do it right. I tell people when I hire them, you're either in or all in or you're out. That's it. You got to have the passion. We are talking.
I'm sorry, Sarah, but so you dismiss people out of your program too?
Staff. If you don't come in, if you don't have the qualities, if you don't have the passion, you can't stay.
Clients, though. Do you dismiss clients?
We try not to. We will do everything not to dismiss a client.
Okay.
That's not something I believe in. But on the adult side, we are working with them to do some jail in reach with Communicare.
Let me do this on that one issue. Don't do apples and oranges, though. The recidivist rate at the jail is adults. The whole juvenile system is geared entirely different. Everything in the juvenile system is geared to getting these kids into treatment early on and all of this. If on the adult side, you go out and you get probation, you're on probation, and there's nobody there. You don't have a court counselor. You don't have a Sarah. You don't have all of these other things. So the juvenile system actually works a whole lot better, and that was why I think we pushed to get these 16 and 17-year-olds into the juvenile system, because of the number of services that can be provided, and that's what she does, is because of those services for that. So you're going to have a higher recidivist rate on the adult side in jail because they just get out and they're just out. So that's just, yeah.
To your point, Mr. Chair, and
Yeah.
thank you
I'm
for
sorry.
the easy segue.
Yeah.
Because apples don't turn into oranges, okay? So apples turn into older apples, and with her success rate,
Right.
in 24 years of doing this, I would think that not everybody commits their first crime when they become an adult. So they should be, I would think that what I'm hearing Ms. Halleck say is, if we didn't have this program, you'd need to build 3 more jails.
Well, that's true. But now, hopefully, because in the last year and a half, we just got these 16 and 17-year-olds into
Right.
the juvenile system. When they were in the adult system and they just get slapped on their hand and they keep on going, that's where your recidivist rate comes.
And I don't want to belabor this, but if you have a system that works like that, and we have one for adults that doesn't work, I would think that there's a further discussion that should happen.
That's
but
above my pay grade.
My last question, well,
That's the stake on that.
okay, my last question is, how do you market to the community?
Great question. We would like to do more marketing. I would like to market to folks that have mild depression and not just focus solely on the juvenile system and the court systems. The honest truth is, sir, that we are moving into doing many more assessments than counseling because of the demand for those services. We do the most comprehensive clinical assessment than anybody in town. And so that is a priority, but we've got to get enough staff to be able to handle more of that demand. We are, though, because of that forensic pilot program through Alliance, we are also talking to the jail about doing more in-reach, because I believe if we can do good jail in-reach and transition them better out of the jails, that will reduce recidivism.
Okay, so, and I'm going for something here, but so how do you update your website? How do you update your social media? How do you update, how do people know the services that you provide? If somebody, you said, oh, a neighbor has to do it, but if somebody's looking for your service, do you update it enough? If I pulled up your Facebook page right now, would it be current?
No.
Okay.
No, and that is completely my fault. We're busy. We're trying so hard to recruit good staff and keep good staff, and I've been the sole person for that for so long. I've got to get help to do that. Our website needs to be updated, but we are working with the county IT. That's where our website is housed with a contract that we have with them. So I have much better materials to work with than just my imagination, and you saw my IT skills earlier.
Okay.
Yes, I just wanted to make a comment. First of all, I want to thank you, Sarah, for your presentation. And I just want to also say that it's been a privilege to know firsthand that the program works, because I worked for the Juvenile Assessment Center Community Care for 8 years, and to see you all develop and to grow, and just the fact that you're keeping the consistency. I talk a lot about data around here, and I did get that from one of the founders. I came out of the community care system, Dr. Robin Jenkins, and also the founder, John Clark. So you're doing a great job to keep their vision going. And also I want to say, a question is, do you all still, because it's been a long time, do you all still do your referrals in regards to getting information out through the school systems? And also, I know that a lot of times we were able, with counseling, referrals to the school systems, referrals to the churches. Is that still in place in regards to that?
Yes.
Okay.
It is, Commissioner Jones. We are still doing that. The schools are still a great project partner. So we are still trying to connect with the churches as much as we can.
Okay. And then that was my last thing. I'm just glad to see that the consistency with the data. I know when it first started back in, I think it's been 2004 or 5, Dr. Jenkins and late great Mr. Clark, I think that it would answer one of their questions when you said how well they do it. They were very consistent, and you're absolutely right for the staff, making sure if you're not on board to do it right, not doing it all. So I just want to commend you all for keeping that standard. Good seeing you again.
It's good to see you.
Thank you. Thank you so very much. I would also bring to the board's attention that, and we do fund JCPC, which funds CommuniCare. And for that, Mr. Keith, you were asking about letting the public know. They created a whole public information section within JCPC for all their providers to be able to get that information out to the community, and I think appear before this board, the city board, so that people will know that. So they just did that yesterday. Ms. Keens was over there with us. So, and they are one of the providers through JCPC. So our funds are being used very well. Thanks so very much. That will take us to our next presentation, which is the Continuum of Care. Mr. Manager.
Yes, Dee Taylor, Director of Community Development, and Debbie Brown, the Executive Director of the COC, will provide an update on the homeless activities in the county.
Good afternoon, Commissioners.
Good afternoon.
As mentioned earlier, we have with us one of our strongest advocates for the homeless in our community, Ms. Debbie Brown, who is also the chair of the Fayetteville Cumberland County Continuum of Care on Homelessness. She's here to provide an overview of the COC and its roles and responsibilities, and I will chime in from time to time to provide some additional information on the COC and its programs. And so let's see, stop sharing. No, that's not sharing. Is it this one here? You need to come. Yeah, I got it here, I think. No. He's coming.
I got it. They got to share it on the screen.
They have a copy of it.
Yes, have a copy of it.
Well, good afternoon, folks, and I appreciate the opportunity to be able to come and speak with you. I apologize that we can't get this on the screen, but I think you folks have the presentation in front of you. So the desired outcomes from our presentation are to share with you the background of the Fayetteville Cumberland County Continuum of Care on Homelessness, or as I will refer to moving forward as a COC, the mission of the COC and how we function, coordinated entry, the COC's funding sources, challenges of the COC faces, and future outlooks for success. So under the Hearth Act of 2009, an entire community rather than individual service providers must demonstrate success in preventing and reducing homelessness. HUD requires that COC provides a comprehensive response that ensures homelessness is prevented or abbreviated whenever possible, with the understanding that individuals have the right to self-determination. The COC is a coalition of nonprofits, faith-based organizations, local governments, healthcare system, advocates, and those with lived experience of homelessness that comes together to organize and deliver housing and services to meet the specific needs, thank you, of the people who are homeless or at risk of homelessness. The COC is a 501c3 nonprofit. So in 1994, communities around the country were to develop a process by using a single comprehensive planning process when applying for HUD's McKinney-Vento homeless assistance funding. This funding being the primary source of funding targeted to meet the needs of homeless persons and families. This act combined 3 programs to become the COC program, those being supportive housing programs, Shelter Plus Care Program, and Single Room Occupancy Program. In 1996, the Cumberland County Continuum of Care Planning Council was birthed. The mission of the council was to facilitate the coordination of the community's human agencies in addressing the needs of the homeless persons in the Cumberland County geographic area. There are approximately 400 COCs in the nation. There are 12 COCs in the state of North Carolina. All of those, except one, are combined by city and county entities. The North Carolina Balance of State, COC, is comprised of 79 counties throughout North Carolina. The remaining 11 COCs show which county and cities they represent. Thank you. So the COC's mission is to facilitate the coordination of the community's human service agencies and the community at large in order to adequately set strategies for addressing the needs of Cumberland County's vulnerable populations, to include homeless persons and those persons at risk of becoming homeless through the continuum of care systems. Since we are about housing these persons, we have a word cloud graphic showing some of our partnering agencies. So the COC serves the main priorities of HUD, which are to operate a functional COC, implement a coordinated entry system, manage the HMIS system, strategically plan for the COC, and prepare for the annual application for funds. The COC 501c3 does not provide housing and services directly to participants, as we are the facilitator of service providers. Those service providers, or the continuum, are the ones that assist with housing services. This visual gives you the makeup of the COC service providers, with each gear connected to the main COC gear. You will see that the listed agencies are members of the COC and those service providers with specific resources available to all of those homeless or at-risk homeless in the Cumberland County geographic area. We come together to work toward the single goal of making homelessness rare, brief, and non-recurring. Note, this does not include some of our newest agencies that are now partnering with the COC, and in one in which we're working towards an MOU, and that is with the Cape Fear Valley Behavior Community Paramedic Program, and the changing of the name, you see Fort Bragg instead of Fort Liberty. Those will be changed, changes will be made shortly. So the COC is governed by a board of directors, the chair, vice chair, secretary, treasurer, city ex officio that is appointed, our lead agency, which is Cumberland County Community Development Detailer, and then up to 10 members at large. HUD does require that each one, or there be at least one individual on the board who is either formerly homeless or is currently homeless. We have 5 committees in which participants, COC members, and/or COC active members may join in the work. Please note that all of our board of directors are volunteers, with no one receiving any funding for services provided as that board member. So the COC became a 501c3 in April of 2018. Our budget from that point forward is listed for you. And I share this with you to show you that in our budget, we receive no federal, state, or local government funds given directly to the NC 511 501c3. So what exactly is coordinated entry? How does the COC coordinate homeless individuals as they traverse through the intricacies of shelter and housing? HUD's rule defines coordinated entry as a centralized or coordinated process designed to coordinate program participant intake assessment and provision of referrals. Coordinated entry or intake was mandated by HUD for all COCs in the nations and those that receive projects funding by either the COC program grant or the ESG or Emergency Solutions Grant Program. Those homeless or those at risk of becoming homeless may go to any of the access points, call the coordinated entry number, which is 844-401-HOPE, or NC211 to receive any assistance. Those calls that go to the NC211 automatically are sent to our coordinated entry. Access points are located at Cumberland HealthNet, Operation Inasmuch, the Salvation Army, Manna Dream Center, and First Baptist Church on Anderson Street. All avenues lead to coordinated entry. The coordinated entry team will use a triage tool known as the VI-SPDAT, designed to quickly assess the health and social service needs of the client and match them with appropriate support and housing interventions. So let me share an example with you. A lived experienced person has been assessed, and it is found that she is chronically homeless, has 3 children, and has a major health challenge requiring significant levels of support and has frequented the emergency department. She will be prioritized higher because of a higher acuity number than that lived experienced person that has had a life event happen to him in which he has now found himself homeless, needing assistance to get back on his feet, but does not have that major health need nor children. So those clients must wait for shelter or housing or placed on our by names list. As beds become available, those clients are moved to shelter setting or into housing into which that individual has the say about which location they are moved. Our COC, in collaboration with Fayetteville Metropolitan Housing Authority, were awarded 33 emergency housing vouchers. All 33 vouchers have been issued to individuals and/or families, and all of those are currently housed. So let me say this for clarity of what the coordinated entry is and is not. As stated, coordinated entry assesses, prioritizes, and refers clients to resources needed. Coordinated entry does not find housing for persons. They listen, determine the need, and make referrals. So you were given the 5-year budget of the 501 COC. The COC applies for HUD funding, which we will share that information with you in just a moment. The HUD grants received by the COC do not come directly to the COC 501 funded parts. Please understand that. Those service agencies that apply for and receive funding have a contract directly with HUD, and those funds come from HUD to that service agency, not through our bank accounts. Dee's going to share more about our funding sources and how the COC applies those fundings.
So as Debbie mentioned, part of the reason why the COC group exists as well is because of the funding source made possible through the U.S. Department of Housing and Urban Development. Their main role is to strategize on how to best use that funding. And I'll explain the funding levels for those 2 programs, for the Continuum of Care Program and Emergency Solutions Grant, shortly. The other main federal funding sources that flow through our community that addresses homelessness is funding made possible through the VA. This is through a partnership with the VA and the Housing Authority. They're able to issue vouchers to homeless veterans to help support their needs in for finding permanent housing and access to supportive services. Then there's the Supportive Services for Veteran Families grant that is used also for providing permanent housing and supportive services for homeless veterans and their families. And then the Grant Per Diem program, which targets those transitional housing programs, service centers that provide assistance to veterans. Then there is the SAMHSA, which is the Substance Abuse Mental Health Services Administration, that provides the PATH program funds through the state state agencies, Department of Health and Human Services, that provide different funding that addresses the housing needs and mental health services needs for those who are homeless. Now, This past December of 2022, the U.S. Interagency Council on Homelessness, along with other federal partners, to include HUD, developed what we call a federal strategic plan, and they called it All In. And it basically outlines strategies in which communities across the country can address homelessness. They outlined strategies that would combat discrimination, especially for those who are who are facing homelessness. Best ways to use our data to make informed federal policy and funding decisions. And they encourage, of course, agencies from all levels, from the local, state, and federal levels, to collaborate to best serve the homeless in our community, how to prevent homelessness, and to improve our response systems in our community, and as well as expand affordable housing in the community. And as mentioned earlier, the two main funding programs that we receive through our community and why the COC exists is the Continuum of Care Program funds. And as you can see, over a 5-year period, that funding level has increased, but to serve, to be provided to various housing types and services. But one of the main things I wanted to point out is that in 2018, you would notice that we had more funding that was provided for transitional housing program. But, over the years, HUD has focused more on permanent housing needs. So that's why you see in 2022 that we only have basically one transitional housing program that exists in our community that serves homeless families with children, and that is the only one in our community. The remaining, of course, is spread out to provide permanent supportive housing, which is more project-based and targets those homeless persons who have a disability. Rapid rehousing assistance involves placing an individual who is unsheltered into housing and connecting them to services. And then supportive services only supports our coordinated entry program, and the COC planning supports the COC planning efforts. The other type of program that we receive, funding that we receive in our community, is the Emergency Solutions Grant. Again, this is passed down through the state. Currently, there are two main agencies that receive funding, and that is to address shelter operation and services targeting victims of domestic violence. The other agency used the funding to provide street outreach and rapid rehousing. Another main function of the COC is, and along with volunteers, is to conduct the point-in-time homeless count. This information that is conducted at least the last Wednesday of every January is reported to Congress so that, again, they can make inform federal policy decisions and how to distribute funding throughout the communities. And as you can see, over the years, it has fluctuated. The gray line you see represents our unsheltered count over the years, with the orange line representing the unsheltered count, and the blue line representing the total count in our community, which in the last couple of years has pretty much been about the same. Now, keep in mind, this is just a snapshot. It only captures that number within a 24-hour period. So the last Wednesday again in January. It's not a total count. It's not an accurate count. It's just a snapshot. Yes, sir.
Yes, you may.
All right. I go back, point in time has always been a reference point. And every time we talk about point in time, they say the same thing you just said, which was, hey, it's just a number, okay? 'Cause we don't really know, and you and I are talking enough to know that there's different definitions of homelessness.
Oh, yes.
Yeah,
Yes,
right.
sir.
So to take that broad brush and to say, oh, homelessness is here. Is there a requirement, because every time we do point in time, I can't remember it ever being above 600 for the last many years. But if it's not is there an actuary out there that people use to say, if it is 300, it truly is by HUD definition X? Because every time that people come to us asking for money for affordable housing, the only way we could possibly plan transitional housing or affordable housing, the only way we could possibly plan is to know what the need is going to be. And if we don't know the need, and we only can go by this number, which is always false. It's not right.
Right.
We know it's not the right number, but is it close? Or is there a multiplier? And by what definition do you use to come to the commissioners and say, we need more affordable housing and we need this much affordable housing? Because it seems very subjective all the way through. So
Yes,
I asked you a lot of questions, but why do we even do, is there a requirement we have point in time?
Yes, sir. HUD.
Okay.
Yes, sir.
So do we just do it to meet the qualification and we shouldn't put any reference to it at all?
Oh, no, sir. I mean, communities use this number as a baseline. It's used to better understand the characteristics so it's a sample that we use to better understand, okay, we seem to have more single, unsheltered adults in the community, or we're seeing an increase in victims of domestic violence. So this data is used, like I said, this is reported to Congress, and this is how they determine how the funds are best used. To your point, yes, the definition of homelessness have changed, which is why you see, if you go back to probably between 2012 and 2015, what I can remember, the number at one time was, I believe, over 1,000 of homeless, because that included those who what we call are at risk or who are doubled up.
So we changed the metric.
That definition, the homeless definition, changed between that 2011 2012 period.
It's a struggle for us.
It is.
Because
Yes, sir.
we're only as good as the information we get, and if it's different each month, it looks like a spike, but there's a reason.
Exactly. So that's why the numbers, these numbers, they don't capture those who are couch surfing. This does not include those, because a person can be homeless the day before we conduct the count. And then maybe staying with a friend on the day of the count. So we can't count them in that. In the point in time count, because they don't meet that definition.
The opposite is true too.
Right.
They count them, and then a week later they're getting some sort of emergency shelter or staying with a friend too. I'm just trying to put a number to it.
Yes, sir.
Or at least one that we can plan.
Oh, sure. Come on.
If I may share
Commissioner
one-
Jones, excuse me, Commissioner Jones?
Yes, looking at the chart, I have a question.
Yes, ma'am.
Now, I know that you all just do the connections and partnerships, and under housing, I think I counted, there's like 20 of these, and out of these 20, probably only 5 actually do permanent housing. And my question is, because as you stated, HUD is now primarily just wanting to fund more of programs that have permanent housing.
That's correct.
So the question is, because you stated that's why there was only one, correct?
Yes,
In your data?
transitional housing.
Exactly. So my question is, what particular initiatives of action are you all doing to try to, I guess, build partnerships with organizations that are providing more of the permanent? Since out of this list of 20, there seems to be, offhand of the ones that I just know offhand, like the Kingdom Impact, Service Source, I know that they do permanent. So what are you all doing to try to, I guess, increase partnership with individuals? There's 5 out of 20 that have permanent, since HUD is primarily putting more money into those that have permanent, long-lasting, and not just temporary housing.
Well, we encourage every year when the HUD's notice of funding availability comes out, we try to encourage different agencies to apply for funding. to expand, to help leverage the funding, because it is still limited. You're talking only about, as you can see, on average about $800,000 that comes through the Continuum of Care, HUD's Continuum of Care program. And so it is still limited. And then, too, it is still challenging trying to find agencies that have that capacity. Again, we try to encourage more agencies to come forth and apply for that funding and help leverage, like I said, the funding resources in our community so that we can expand more beds and so forth. But it's only so many agencies that can,
And one more
handle that.
question, I don't know if this would be in you all's parameter to be able to do this or not, but just, I guess, thinking outside the box. Is it possible or is this in you all's realm to be able to perhaps reach out to developers to see, or negotiations to see if they would be willing to perhaps do some type of project? Because again, as you stated, some agencies are only limited what they have. So has that been maybe a thought or possibility, something we could look into? Just a question.
Oh, yes, ma'am. Actually, that is what we're doing. We have been trying to form MOUs with some of the developers, these agencies that provide low-income housing, and hopes that they can designate so many units that target the homeless households. And also, like our community development department, in our last RFP that we issued, one of the developers that applied for our funding actually is planning to use the funds to target those households. 100% of the units will be targeting those at 40% or below. So that would capture the homeless households.
So in a future presentation, can we perhaps keep an eye on that for you?
Oh, yes,
Give us an update on where they're standing with that particular
Sure.
project.
Yes, ma'am.
Thank you.
And I think I cut you off. You were going to say something?
Yes.
Go right ahead. They were just in the middle of that. That was all.
Oh, no, that's fine.
Yes, ma'am.
And I'd like maybe to address a couple of things. One of the things that you were talking about is with affordable housing, which, yes, I will be addressing. But I think that what I've tried to do is to go to HUD, to look at our HMIS, to look at the trends over the past few years to see where it is we are specific needing now. It may have been that it was single men, but now is it more families, that type thing. And so when we're talking about percentages of folks, what areas we need, if I'm coming to you and saying, I need you to help us get affordable housing, then I want to be able to have an intelligent number to say to you, here's an area that we need. So I just wanted you to understand that that's still a work in progress. We're working towards those items. One of the things that you had asked about with the land developers, well, let me go back to the first one, where you were talking about increasing folks being able to come in. I feel like that part of my job as the board chair is to go out into our community, to talk, to reach out, to find out what I can from an agency. How do they work? What do they work? How can we interact? So one of the things that we as a COC realize is that we need landlord, an event called Landlord Engagement, which we are hosting September 14th from 6 to 7:30. And we will be asking them what they see the need is from a landlord perspective. And we're going to share with them what we're seeing we need from that COC homeless perspective and try and start that communication to see if we cannot eradicate some of the evictions, some of the myths, trying to build that communication between those landlords and those clients. But I just wanted to try and hit all three of those.
Thank you.
Thank you so very much. Thank you for the presentation. All right.
And,
Oh,
we're
I didn't know.
almost
Go ahead.
finished.
Let me-
We're almost finished.
I thought y'all were finished. So how about that? Go right ahead.
Okay.
We get close to it, though. Go ahead.
Oh, sure, go ahead. No.
That was a strong
So,
one.
as you all know, there is a shortage of affordable housing in our country. Our COC, approximately our $1 million, currently provides Cumberland County geographic area with 58 units and 131 beds. So we are using our funds to get homeless individuals off the street to the best of our ability. And as you know, federal funds come with strings attached. Those strings can become cumbersome for our COC agencies, and HUD only allows a small percentage for those administrative needs. Well, we know that our wraparound services needed for our community is great. With limitations that HUD imposes on the administrative side of the grants, it limits our COCs in being able to provide that case management that's so needed. So with this, we wanted to show you some other sources of funding which will supply that need and those challenges that come with it.
Okay, so of course, we get the question, well, you have these funding sources and other services, why are there still homeless in our community? And these, of course, some of these challenges are not, it's not something new. We all know that there is still a lack of affordable housing in our community. The rental assistance that we do receive in our community sometimes is still not enough, especially if there is a lack of affordable housing, because we have the funding source, but then we don't have the units that are available and that are affordable to those who are in need. Yes, sir, did you have a question?
Commissioner Keith.
How many affordable, when you say affordable housing, what do you mean? Definition.
Those who, for those, our target population, whatever is affordable, something that does not exceed, by HUD's rule of thumb, 30%.
So we're not talking about homeless now. We're not talking about a shelter or transitional housing. We're talking about affordable housing.
Yes,
Right?
sir.
So okay. Affordable. I've heard it. There's a lack. There's a lack. There's a lack. How many units do we have right now of affordable housing units in Cumberland County? And what is the number by some sort of definition? Where's that lack? What is the difference between what we have and what we need specifically?
Well, sir, I just know probably a few months ago in getting the update from our local housing authority, I know that for the Section 8 housing, they had over 1,000 on the wait list.
Okay, how many do we have right now? I counted 17 properties.
I believe it, if I'm not mistaken, I haven't gotten an update, but I'm sure it's probably an increase since then. I don't have that exact number, but several months ago that was about 1,074, if I can recall. And then for the public housing was because they opened and closed their application portal because of the number of applications. I think they had about 215 at that time that was waiting for the public housing. Now, I can't give you a number for the private entities. I don't have that updated number, but it's still, they all still have a wait list, a large wait list.
Housing, we're just over 1,000.
For the Section 8 housing through Housing Authority. Okay. Yes, sir.
And you believe that there is a need that we should plan on for another 1,000 based on previous numbers that you have?
Yes, sir. We definitely.
So 2,000.
Oh, more.
Well,
Yes, sir. Of course. Yes, sir.
How can we plan? Should we plan for 1,000?
Yes, sir.
Now, the other part is the economy. The reason we need affordable housing is people can't afford housing. The economy, the price of a house has gone up completely in the last couple of years. The rents have gone up. But are these still the same numbers that you're looking at? Is that not affecting the need?
Oh, yes, it's definitely have increased. And that's the reason for us having, which is the other challenge, why we have to prioritize because of the high demand for housing. We have to prioritize the households who would access those units first because of the high demand, and the limited resources that we have. I mean, it's a major problem, sir, that I wish I had an easy answer, but.
I just need to know what you want us to do. We keep hearing we need more, but there's never a number. But when you're telling me we're 1,000 short, if you put 100,000 in each one, we need $10 million and we can take care of affordable housing in this community. That's the math. But I don't think that would happen.
No, I think we're always unfortunately going to have that need. The main thing is we can't build units fast enough. That's one of the major problems.
I'm not getting to where I need to make a good decision though.
Commissioner Jones.
Okay, so the 58 units you were discussing and the 138 beds, so that's just for transitional, not permanent, is that correct? You stated earlier that the availability was 58 units. I just want to make sure I'm correct here. So the 138 beds, is that just for temporary? I wrote that you stated there was 58 units availability and 138 beds that we were utilizing. Is that just for transitional housing?
Oh, no, the 58 units and 131 beds.
Use the microphone, please. Thank you. I'm sorry. I just want you to be.
The 131 beds that I was discussing, those are our programs funded. They are all like emergency or rapid rehousing or transitional or
Those are
permanent.
permanent. I just want to make
All-
sure.
Yes, ma'am.
And then one last question, since he was stating, I know there is a shortage and there's a waiting list. I've had individuals call me. Is it still a 3 to 5 year waiting list? And maybe this is something for the landlords when you all meet with them. Is that because the leases in the affordable housing? I don't know, so I'm asking because my understanding is people call frustrated saying there's a 3 to 5 year waiting list. Is that because the lease, when you get into affordable housing, is 3 to 5 years? Or I don't understand why is the list that long? Forgive my ignorance on that.
Well, that's just the need. Again, that's just the number of people that are in need that it just takes that long to
So that's
get
why they're
housing.
telling them 3 to 5 years.
That's mainly the reason. Yes, ma'am.
Okay, I just wanted to understand that. Thank you.
Thank you. Unless you have something.
I'm
All right, thank you.
unless you want to tell the success.
They have one success
Oh,
story.
yeah, I always tell the success story. Commissioner Booth wants to hear that.
I do.
He wants to hear that.
I think it's
Dee was listening
something
to you,
that you'll be
see?
excited
Thank
to
you, Dee.
hear. So, an individual that I will not share her name, but she says, bad choices and being involved in bad relationships led to bad consequences. This person with lived experience, who is a homeless mom with a son, found herself in an abusive relationship while living in New York. She decided that she was packing up and moving to North Carolina without having any plans for her or her son once they arrived in Fayetteville. She shares that she did not know anyone, had no plan for where she would be staying, and stated that she was not the typical homeless individual, as she did have a disability check coming in monthly. However, she does say that even with this, it was not enough to cover the first month's deposit for rent, utility, etc. She said that she did not want to ask for any assistance yet, found the motivation and self-determination to do so because she had a son to provide for. A big realization for her was that she had to provide for herself in order to provide for her son. She sought assistance through the care center, having come from an abusive situation. She stayed at the Salvation Army while also receiving assistance from DSS. She was given other resources in the community that helped her get on her feet. She was introduced to Connections of Cumberland County, where she received great care, she says. She states that there were resources out there for her for which she was thankful, but she learned that she could not rely on these agencies exclusively. She said that she does sometimes wonder if she will become homeless again. She has had 3 addresses while living in Fayetteville. Her rent was raised above what she could afford in the first setting. The second address was an apartment in which the landlord sold the complex, and the new landlord decided to gut out and seek new applicants. She has been able to afford and keep this third home. With this, she notes that affordable housing is a concern for our community. If you are fortunate enough to get a Section 8 housing voucher, you may find that you're on the wait list for years. She tells us that there is a need for landlords that are willing to put it out there, as she states, apartments that homeless folks may be able to afford. For a single mom who is working, child care expenses are a barrier in keeping a job. Minimum wage without government assistance will not get you an apartment, she stated. Think of it this way. With a one-bedroom apartment, holding down a job, having to pay for child care, it just doesn't work. It becomes a cyclical pattern of trying to work but cannot continue in the job because you cannot afford child care. Having earned a Bachelor of Science in Crisis Counseling, a Bachelor of Science in Addiction, a Master's in Social Work, Selective Trauma and Disaster, and being a doctoral candidate in counseling, she states that it is not that I've done anything remarkable, as anyone that sets their mind to can do it. She continues that homeless individuals often do not choose to be homeless. A health crisis, loss of a job, a house burning down are all events that have caused someone to go from a six-figure job to being homeless. Once they do find themselves in their situation, though, they must take advantage of all the resources offered that come to the mindset that they need help. They have to do whatever it takes to get over the addiction, or that they cannot do it alone. She says that it's the most humbling experience one faces and is very detrimental to one's self-esteem. Go to bat for yourself, she continues. That's what she has done, and she feels proud of her accomplishments. And the reason I share that, she is employed by Cumberland County.
Thank you.
Thank you.
Mr. Booth, you got it.
I got one, thank you. Been asking for it for 6 years. In fact, I went down before the city threw them all out from underneath the Gillespie Street Bridge and talked with two that I was going to actually do a spa day makeover on two of them, bring them to y'all. So you could bring them and I could go, do you have any success stories? You go, yes, right in here. And because two of them wanted to go and finish their GED, I called the folks at FTCC, and they were, Dr. King was willing to get in on it, and everybody's willing to help. It's just, and I was going to do the driving, went back there the next day, one had changed his mind, and one had left. And I spent 3 days talking to them, and all prepped up for it, and I went down there, and then about 2 weeks later, the city said, we have a cure for homelessness. There we go.
Well, thank you, ladies, very much. And I will say this to Commissioner Keefe, Commissioner Stewart is on the line, to Ty, Heather, and to the staff, that as she talked about the success stories, those were some of the nonprofits we did out of the ARPA funds. So it does work. And so just to bring that to everyone's attention. That will take us to the consideration of agenda items. You can stay if you want to. You don't have to. I know you want to get back to work or whatever, so I don't want to think you have to stay here and listen to us. Heather just is smiling over there. The recommendation for the contract for outside attorney services for DSS, I'll call on the county manager.
Yes, Brenda Reed-Jackson, Social Services Director, will present this item. Due to vacancies within their attorney staff at DSS, they are making a proposal to hire outside attorney firm to handle some of their DSS cases.
Good afternoon, Commissioners, and thank you for allowing us to come before you today. The DSS legal division, they handle programmatic litigation related to the state mandated for child protective services, adult protective services, and guardianship cases in which we are mandated to provide services to. Due to, as County Manager just mentioned, due to our current staffing, we're in desperate need of assistance to help us meet those programmatic challenges and those mandates. Included in your packet, we provided a legal staffing outline. You'll see in that staffing that our attorneys currently are carrying about 80 cases. The Bar Association recommends about 40. We have about 7 attorneys. We have 7 attorneys, not about. We have 7 attorneys. Of those 7 attorneys, including our managing attorney, we have 4 field. The 4 that are field have been on the job 60 days to a little over a year of the 4 that are field. We have 2 pending resignation. Those have announced their last day being August the 18th and on September the 2nd. We have 1 attorney who's announced their plans to retire in the fall. I want to thank the county manager for recently increasing the starting salary for our attorneys from $73,304 to $85,815. That happened on July the 18th. After that occurred, we received 3 applications, and we were really, really excited about that. The positions have been continuously posted. We have 1 vacant position now. They've been continuous posting for several months now. So with that change, we did receive 3 applications, and we're again very excited. Unfortunately, 1 applicant submitted 2 applications, so it really was only 2, and neither one of those applicants meet the qualifications. You may ask, well, where are these attorneys going? We have attorneys that have gone to New Hanover County, Craven County DSS, Alliance Health, Private Practice. We lost 1 attorney and 1 potential hire, thank you, Rick Moorfield, to the county legal department. And so Rick grabbed that person before we could. And then our managing attorney also accepted a position, which was well-deserved with the county legal department. And then recently we lost 2 to Durham County, including our managing attorney who's here with us today, Patrick Kuchik. He will be leaving to go to Durham County on August the 18th. As you know, Commissioners, we came before you at the June agenda session meeting to request consideration to allow us to hire outside attorney. The Charleston Group was the only law firm that responded to that RFP. The initial RFP was issued on May 19th, and then it was a very short deadline. It was then extended on May 23rd for 2 more weeks with a deadline of June 5th. When I came before you in June, you expressed concerns about that not being a good time frame to give attorneys and law firms an ample opportunity to respond to the informal RFP. You directed us at that time to reissue the RFP, which we did. The RFP was reissued on June 19th for a duration of 3 weeks. The only change we made in the informal RFP request is we did add language to ask anyone responding to address how they would handle conflict of interest in their response to the proposals. And so the RFP actually has been out there now for a little over 5 weeks total. Unfortunately, we only the same results. We had no attorneys and only 1 law firm to respond to the RFP. That is, again, the Charleston Group. They did address the conflict of interest in their proposal. They presented to us their deliverables and their rates as follows: $207 per hour for attorneys, including a $7 admin fee, $157 per hour for paralegals, including a $7 admin fee. Looking at an average of 30 to 40 hours per week for the attorney and paralegal combined, for a total for 1 year of approximately 2,040 hours. If given approval to move forward with the proposed contract, we would hope to have a contract in place by September 1st. Given this is August, a 1-year contract would include over 2 fiscal years, a current fiscal year at a cost of $346,677, and for fiscal year 25, which would be the 2 months of July and August of 2024. I can flip over to my page here. It would be $69,333. The grand total for 1 year would be $416,000. We project 44% state and federal revenue with a net cost for 1 year contract projected at $232,960. We feel fairly confident we can have a contract ready, including the legal review and the county finance review by August the 21st. And with that said, we request entering into a contract with the Charleston Group as outlined, effective September 1st, 2023, for your consideration as a consent agenda item for your August 21st regular session. I would be glad to answer any questions at this time.
Commissioner Fairclough.
Thank you, Mr. Chairman.
You recognize by the chair. Okay, go ahead. Commissioner.
Brenda, what ongoing efforts will there be to still hire in-house attorneys, even if this contract does take effect?
So we have constantly made recruitment and retention effort, and so we have done job fairs. We have reached out again to bar associations. We've reached out to law schools. The attorneys, one attorney we just recently hired was a paralegal who went back to law school and passed the bar, and we were able to hire them. We're constantly trying to make the necessary connections, and we will continue that work. We're certainly hoping that the increase in the salary would help. It's tough out there. It's very, very competitive.
Okay, if I can follow up, okay, and if these efforts are successful, what impact will they have on these dollar amounts here?
Well, if they're successful, we would hope that we wouldn't need the contractual services. We don't.
So it will supplant that. So this is not a firm contract unless the services are used, and if you end up hiring people, you may not have to use the entire amount. Is that correct?
Yes, sir. We have a termination clause in the contract. We propose a termination clause.
Yes.
My question is this, and I did do some research on this. Cumberland County is, of course, a lot larger than Hornet County and Rayford. And these prices, I'm a data research person, and from me just, I'm all about the people. So I know that these services, working at DSS, working at mental health, I don't like for people to go without services unneeded. I appreciate you all putting the information out there. And as we all know, attorneys can get it done when they want to get it done, to include an application. This is my thought process. So I also researched this individual organization. It's my understanding they do have experience, and I don't know if I'm allowed to say this or not, but I researched their attorneys, and I think that it would just be a benefit. Plus, I think one of the attorneys on the Charleston group used to work for DSS, and being that, to me, common sense, if you have someone who's worked as an attorney for DSS that's now in this firm, is my personal and professional opinion, you're already 80 cases behind, I believe that would be a benefit. And if I'm not mistaken, from the research that I've done, I don't know I think it's Rayford or Hornet County, this particular group also handles their DSS. So I feel that the prices, from the research I've done, Cumberland County is one of the largest counties in North Carolina. And these prices, no disrespect, if Hornet can pay it smaller than us, and Rayford, the people of Cumberland County that need these services, and you're already behind, deserve the same quality of care. So I'm personally hoping that we will take that in consideration. And again, 5 weeks, 2 weeks, attorneys have to get in things a lot quicker than that. And no disrespect, but if someone can't get the application in by then, they probably aren't going to be able to handle these cases at DSS.
Commissioner Booth.
Thank you, sir. I don't have it in front of me right now. I've actually printed it out. What is the termination agreement or contractual way of, okay, we hired 3, we don't need you anymore. How much time do we have to give them to stop the clocks, close out the cases they have, and move on? What is that language?
So we would work with the contractor with that, but typically in our contract language is a 30-day termination clause in the contracts. And we would, of course, if they're in the middle of litigation of a case, we would work through what that transition looked like, whether it would be one of our existing attorneys, once we get them on board, that are able to pick up that case, so on and so forth. So we would work with any contractor around a transition. We have service contracts all the time where we have maybe someone doing professional services that we would have to transition out their services.
Okay, so you anticipate 30 to 40 hours a week. Is there a cap so that we don't get a bill for 58? Like, 58 hours, 40 at the usual rate, and then time and a half for the other additional 18 hours or something? I mean, if we're that jammed up, a part-time attorney coming over from a firm that their eggs in the basket ought to be on trying to impress their partners and their bosses back here unless they're trying to leave there and come work for you full time. And that's what I'm saying. I would be much more comfortable us trying to get some more authority to our county manager to get us some folks who want to come in here and work with us all the time and not swing by. Or how are they, if we're that jammed, it's definitely going to be 30 or 40 hours a week. It's not going to be a five-hour a week stop by. So, you wouldn't need a $400,000 opportunity to get somebody for 5 hours a week. So you're going to need them. It's going to be $400,000 a year or more. I would just as soon get somebody. I mean, do it to the next two people you have. You can hire them up to 90. At least that gets us employees that are going to get in their car, come say, "Hey, good morning, Brenda," and they're like that. Not, get a bill and go, did anybody authorize overtime? I didn't. Who's going to tell them? And they're not our employees. So that's what I'm saying. We don't have any supervision over them. It's just such a high price tag. And I think Glenn's done it, and I think his firm's done it. I mean, I was a town attorney for Spring Lake, for Hope Mills. I mean, I've been interim stuff too, but that truly was part-time. It was a Monday night meeting from 7 to 9, and you had to go over the planning session the week before and be available for calls. Not, you're going to be working full-time over there, but we're going to charge 4 or 5 times the going rate because they can't get anybody at the going rate. I say let's up the going rate rather than pay the cost of 4 people to somebody we don't even get to control. So, I mean, it's just a little steep.
So if I could,
Commissioner Jones?
Again, because I'm going to be thinking about the people in need, maybe because I come from that background, we're already behind. We have a qualified group. No disrespect. I find it quite embarrassing that Cumberland County, bigger than Hope County, thank you for the correction, and Harnett County, and they believe they want to get the best for their people, smaller counties, and we know, I've done the research, thank you, I'm sure that I have confidence in Ms. Jackson, she's done the research, and no disrespect, you're an attorney, Mr. Adams, so are you, Mr. Booth. We're already losing people because you have to sometimes pay for quality. We then put the announcement back out there, and so, that's why she's losing a lot of people. The bottom line is, it's a lot of work, and people are leaving because they feel the quality of work that they're being provided. I mean, let's just put on the table. They want to be provided for. Attorneys are very intelligent. That's why it was out twice. I'm sure your staff, in my opinion, from working in the field, people come in, they get great training from DSS, they can get better pay, which is why we're losing people, even the county. So now we have individuals that can provide quality. I'm all about the people. She's done what we asked her to do, and we're still asking the people. I understand you guys want to save money, but the people deserve it. We're still asking the people, keep waiting and waiting. Now, I don't know about you all's phones or email, no disrespect, but I've just been working from home, but I've still been working. So when people are calling me saying, why are my cases built up, why are my cases built up? And I'm saying to them, be patient, we want the most qualified, we're putting an announcement back out, and they're like, okay. Meantime, it's being backed up, not because she has not found a qualified group that, by the way, like I said, is representing Hope County. Very embarrassing. Cumberland County is, just as big, but, we got to put people sometimes over money. I mean,
Right.
we put the application back out there. We can't just keep having cases back up. I mean,
Commissioner Keefe.
that's my opinion.
Commissioner Keefe.
Commissioner Jones, thank you for that. No disrespect is in there, and that was said enough times, but we care about people too. We care about people. Our job is to provide quality services while being fiscally responsible. But my bigger question in this, aside from this, is what do you do next? Because everybody here has acknowledged that it's a problem getting people, right? Ms. Jackson, you're here for a reason. Because, why did you take this spot back? Because there wasn't people coming in. Every single person in a high-value department is having trouble filling spots. I would ask you, why is your attorney moving to Durham?
Are you comfortable answering that question? He's here. You answered that question.
Good afternoon. My name is Patrick Kuchet. I'm the Assistant Director for Legal Services at Cumberland County DSS.
Okay.
Personally, I'm moving mainly just because it rides us to a different opportunity.
Okay.
Candidly, it's a substantial pay raise.
Sure.
As far as my attorneys, a lot of them are moving on because of the pay. That is one of the factors. A lot of the times it's the main factor. But the starting salary up through about 2 weeks ago was $73,000.
Yep.
Harnett County starts at 91.
Okay, we're at 93 now. And I
Up
appreciate
to
it.
120, up to 120. So it's not, don't just do the 89, it's up to 120.
It's on
So
Indeed
then
right
you got
now,
all of that.
140 something.
Right, yeah,
So
140
and
something.
I appreciate it because I always like to know why people, sometimes
Not just 89.
we will never win if it's all about money, because there's always people that can give us more, can pay our people more money. So my point is that you got to start thinking differently. There has got to be a different way to do this, because you're going to run into the same problem next time and next time, and we're just going to have to, we're going to have to find another way to beat this employment problem, because between the federal government, the VA, the state, and all these other municipalities, you can never throw enough money on the table to get everybody to stay. You just got to have a better work environment.
And I will tell you, just from, I'm gonna go to the manager, I saw him there, is that I'm not in favor of this. It's even to the point that if you look in this, you've got even the paralegal has an administrative fee with the paralegal part,
Sure.
Which I don't even get that part. And so the monies in this just don't add up the right way. But here's the thing is, so I proposed a couple of things within the last couple of weeks, and I think one of them the manager did, which was to raise the salary. I would tell you that, and there's no disrespect, Commissioner Faircloth been here for a while, and Commissioner Council, and you all will know that we've always talked about when we start looking at stuff, counties our comparable size. And I think that's the wrong way to look at stuff nowadays. You've got to look at who your competition is. And our competition is Wake County, Durham County, and New Hanover. That's where folk are going because they can get there within. And Wake County pays more, Durham pays more. That's where our folk come. We can't compare ourselves to a Buncombe County, which is our same size, because they're not competing against anybody. I mean, they're in the western part of the state. So, yes, what we're going to have to do, and I even talked to our county attorney, I don't think that just these salaries for our attorneys are low. It's for child support. It's for our county attorneys, our professional staff. We've got to look at our professional staff, even in terms of our senior management. We've got to do it differently than just looking at other counties that are comparable size. And so I do believe that, you saw you got 2 applications that they didn't really pan out, but we haven't given the opportunity when we raised it up to 89 to 120 to see if what we're going to get. And at the end of the thing is, what's the end game? I'm going to just tell you, if I was a paralegal at DSS and I'm looking over here that this paralegal's getting $157,000, you're going to have a mass exodus, even from some folk that's already there who's not making these kind of funds. And so we may end up losing more people than we actually retain. So that was one thing. The second thing is, I did go to our county attorney. He's got 2 attorneys in his office that have worked. One worked directly with DSS. The other one did this kind of court and has been in that courtroom. And I asked it whether, you're talking about 35 to 40 hours, whether between the 2 of them they do 15 hours each. And we've got people in-house to be able to do that, to see if this raise in salary will work. And I think that's a way to be able to do that. We're all in this county together, and that can work. And I think we've got to look at some of these other options beyond just going into this contract. I'll go to the manager and I'll ask him his opinion as to this contract also.
I kind of, one small correction is up to 125.
125, I'm sorry. It's up to 125 now, the
Yeah.
salary.
The
Salary?
Yes, from
Yes.
89 to 125, you can go to that whole route.
And so with the change, I guess the recommended change to start at 93, higher rate at 93, I would just say that I kind of echo the same sentiments that, I'll do whatever is necessary to make sure we can bring people in-house. We will be finished with the compensation study at the end of this month. One of the departments, DSS, not only with their attorneys but also with their other staff, plan to implement as soon as possible. If you all approve the recommendation, but with the contract, if it's a temporary thing, I think that we just need to keep focusing on trying to build our in-house staff. And if the board gives me the flexibility to hire within, and I think I have that preview, if somebody we find is worthy and we want to bring them on, and we want to bring them on between anything above 93, as long as they have the expertise, I'll sign the contract for them.
Commissioner, I had Commissioner Jones, I'll come to Commissioner Booth.
I also have another comment to make here. Again, I'm all about the people. I love all these suggestions and ideas. And as I recall, Commissioner Adams, as you stated, we wanted to make sure that this was we said we want to make this a fair process. We want to make sure the process is fair and due diligent to everyone. And so with that being said, the first time when Ms. Jackson brought this agency above us that we've all checked out that has the experience, that was the thing that I want to remind everybody. We said that due process, fairness and equality for all. So I say that to say not just fairness and equality for this group that has put their application in the second time and for people that have been waiting and waiting. So that's my concern.
Well,
excuse me, let me finish, please. Everyone said, we can't just throw it out there for 2 weeks. We want to be fair. We want to be fair. All attorneys get a chance. We want to make sure that the process is fair. So that was the whole point of why we moved forward. We said we want a fair, due diligent process. No one was questioning, like you said, no favoritism, one group over the other. So I just say that to say that if it's going to be fair, it's going to be fair across the board, meaning process in its entirety. Because I know that whether it's a Charleston group or someone else, if I pull the record, I'm glad it's on tape. And everyone's like, well, we just didn't have enough time to put it out there. In other words, my concern, I guess, is that salaries going up and up, either people are interested and they're not. If you feel your organization or an individual, if somebody wants a job, and we're talking about due diligent process, just like if it was an attorney, if I want a position, that comes up for any other position, we're not just going to keep flipping the salaries and wait a minute, let's get a little bit longer. And so the bottom line is we put it back out there. The same agency that qualified, again, going back to the people, is out there. There is a way, like you said, if this is temporary, negotiations later, but for the people of Cumberland County to just have to sit and wait for representation when we're all aware that there is an agency that went through the process again, that obviously wants to serve the people, is qualified. I just need someone to answer that question to me. Why would people be waiting for services? She's already even further behind now. I just need that question answered. A continuous wait when we know we have qualified applicant. And since we're talking about due process, somebody answer that question for me, please.
Well, I would tell you this is where I go. The process, and I commend the manager and Ms. Jackson, the process this time is fine. I don't have a problem with the process. The process did not include that you would get the contract. The process was the fairness for everybody to be able to submit. We did that, and she did it with 5 weeks, I think is what you told me. So we're not even on the due process. We're not even on whether the fairness. That's done. And I have no problem with them being able to submit. Nobody else submitted. I told you
So
when
are
we
they
did this.
qualified?
Let me finish, please.
Are they qualified?
Let me finish, please. It's not about a qualification. There's two parts to this. The first part is the fairness that everybody got to be able to submit. Now, even then, I told you I didn't know if anybody else would submit, but they at least had the opportunity. So they did that, and we still got the one. Then it comes to the second thing is whether we want to accept this contract or this proposal or not. Those are two separate questions, two separate things. This is, and I do understand, and you ask about DSS court, and I've done DSS court, it's the petitions that we do. Hopefully, as we move forward with some of our case managers, we may not have as many cases as we used to have. This is not people out in the community waiting to get service. These are these petitions that we filed, and being able to do that with the paralegal, with the attorneys, and with our fine social workers that we have that do that work. So it is about being in this courtroom to be able to do that. But it's also about fairness to those attorneys that are there, those paralegals that are there, being able to use qualified people that we already have on staff to be able to do this. And so that's where we are. This has nothing to do, just because you put in doesn't mean you automatically get this. That's the thing. So I will go to Commissioner Stewart. I know she said she had a comment.
I'm talking about families.
Commissioner Stewart.
She's been waiting a long time. Let me ask,
Commissioner Counsel.
how many attorneys do you have on staff now?
We have 7 positions, 4 are filled, and those 4 are filled with attorneys that have 60 days to one has a little over a year experience. So,
Oh, goodness. And I wonder what this does to you with raising the salaries overall. Is that going to be able to cover those that you have?
So it certainly will help us keep the ones that we have. We certainly would certainly want that as a retention effort. As far as if raising the salary, it depends on what the salary is raised to. If it's $93,000, I will tell you that counties are paying more than that. More than $93,000. So again, it does boil down to salary, and I think if we are able to offer a competitive wage, it will make a difference. But I would say it needs to be substantial.
Right. Commissioner Booth.
Thank you. And
Oh, I'm sorry.
That's
You weren't
okay,
finished.
go on.
I'm sorry. I thought you finished. Go ahead.
I was not
Go ahead.
quite finished.
I'm sorry.
Yes, ma'am.
So we have to apply the same standards to the people who are there. You have some right there who are not making what we're proposing, right?
Yes, ma'am. And I do believe that with the class and comp study, when and County Manager, I don't want to speak before you, but I believe the thought is when the salary was increased to 85, that during the class and comp, that those attorneys that are there will be brought up to that level as well. Is that correct?
Okay. And what is happening to these children? I'm concerned about the children that are waiting. I'm not finished yet. Okay, go ahead.
So to echo what Commissioner Adams says, we are, as far as legal services, when we have to file a petition for a child, that means that those legal services are provided right then. What happens with the legal staff is they get stretched thin in terms of the work that they can do. First and foremost, we're going to always make every effort to protect children, but we're doing it under duress and stress and overtime and burnout. I can't stress the burnout. At some point, when you're working these hours, you're going to hit a brick wall, and the quality of the work becomes impacted and those kinds of things. So it's not one singular issue or challenge. It is multifaceted.
Commissioner Stewart. She was going to try again.
She had to go. Did you call her?
She's texting me.
Oh, okay. Should we, since we seem to be stuck, and we need to look at the whole department and the whole issue, should we ask, because it may also have some effect on your staff. I don't know. I don't know what the salary is in your staff that you have. If we could get some new eyes, Mr. Manager, some new eyeballs to look at it from another viewpoint to what raising the salaries is going to do to all of us, and come back based on your experience with a week, because I know Brenda is probably, Miss
Jackson.
Sorry.
Ms. Jackson.
I know she's had a belly full of waiting for this, and children who are on the line. So if you can look at the whole legal process, because we got to include the folk that you already got
Right.
to keep them. Can you do this in a couple of days?
Maybe more than a couple of days.
I want something for you. I don't want Brenda to be, Ms. Jackson to be beating a dead horse here.
You want me to bring it to the next meeting?
Yes, Monday night. When do we meet?
The 21st. I could have it ready for the 21st.
21st, I suggest we do that. So, and look at the whole legal department.
Okay.
Commissioner Stewart, and I'll come back if that's going to be a motion. Commissioner Stewart. She said y'all had her muted, Danny.
I'm sorry.
That's okay.
She still muted?
I'm screen.
Okay, wait a minute. Go ahead. You can just do it off my phone.
Okay, because I'm a screen. Commissioner Council, that's a great idea. Commissioner Adams, thank you for saying that it's not that people's services are not in jeopardy, because I don't want that narrative out there that they're not receiving the services because we lack attorneys. Commissioner Keith, agree with you as well. But in the meantime, we have attorneys who are have double, they're double booked. They got about 80 cases. The standard is about 40, so they're double booked. I absolutely agree that we need to be paying more, but I'm stuck in this. In the meantime, what do? We can't keep pushing this until we get the salaries where we want them to get. And I know it's a lot of money, and I'm not saying that I'm not minimizing that. But what I'm saying is we have in the meantime, and if there is a clause in there that will allow us to get out of this contract when need be, we have to do something in the meantime. And looking at the whole is a great idea. It's what we need to do countywide. But right now, Ms. Jackson stands before us, before you all, with a proposal, and we need to do something. If we only use them for 2 months, we only use them for 2 months. We need to do something in the meantime. We won't be able to get everybody where they need to be right now. So I can't see holding up this other item until we get people where they need to be. That was my comment.
Well, Commissioner Stewart, I think we can use the folk out of the county attorney's office. We've got 2 attorneys in there who have done this and done this for years to be able to do that. This contract doesn't even go into effect until September at best, because you got to bring the contract back for if it's not going to be ready to September. You still got to bring the contract back to the commissioner. So now you're in the middle of September, almost into October, before you can get this done. I think that if the manager can do what he can do, and if we can use the attorneys that on staff already, I know we're going to overwork them, but we can do that. But because we talked about that earlier,
with a short-term sort of situation.
Right, a short-term situation.
If it's you're talking about for a year,
right.
It's just not. It's just
yeah.
not
So if we do that for the next 30 days, 60 days, 90 days, we can do that without having to do this, and then have the manager bring back what he has to bring back. Commissioner Jones.
Oh. One more thing, Commissioner.
Okay.
What's before us today is that we put this on the consent agenda, or we put it on an item of business.
Well, it depends on whether it passes or not.
Correct.
Today.
So what? Okay, let's just see what we can do on that end, so that, and then everybody else do what work they need to be doing in the background because there's some things that were brought up to be So I guess we just see if this passes or not.
All right. Commissioner Jones.
Let me be very clear, and I'm going to make this very clear on my part, and thank you for agreeing with me, Ms. Stewart. There's no false narrative out here. I've worked at DSS. When I speak of, they're going to get the job done, but when I speak of waiting, and just as Ms. Council said, you know, maybe not to us, but when you're a parent and your child is displaced because you're waiting on a case from attorneys, and as she said, they're back up to go forward. I understand we have to be respectful, no disrespect towards money, but when your child is staying with someone else because you're waiting for paperwork to go through, this is what I'm talking about. I'm not talking about services not being done, so that might not seem, it is important to understand that. But I'm saying when my phone is ringing and people are calling me, and they're probably reaching out to me because I've been there, done that as a case manager, 1 or 2 more days, 3 days, 4 days might not seem, you know, a big deal to us, but it is a big deal to families. So let's be very clear. No one is putting a false narrative out there. We understand services will get done. But like I said, families should not have to wait. I appreciate what we're saying in reference to going to give opportunity to the county attorneys that, by the way, didn't have to go through the process. But when we have individuals that can represent families, and this is what they do for a living, and they've put it in something, then I feel like, because we keep backing it up, I still don't understand why we have people going through a process. I don't care what agency it is. We have families waiting, and we're saying, well, wait a minute, let's have the county attorneys. We're going to decide we want to go this route with the county attorneys, because either temporary is temporary. So temporary with people that went through a process that we keep saying needs to be fair and open the process to the people. And now we're saying, well, you know, we don't like the bid information, although again, do look it up in the records. I'm a data person. The money is not asking too much. And the reason why I said Harnett County and Hope County is because the bottom line, attorneys, if you can have less cases, I can say this from someone that's worked in case management. It's different when people haven't worked in the field. Why would you not leave? You don't have to go to Durham. Why would you, here in Cumberland County, these attorneys are dealing with not just Cumberland County issues, you have to deal with Fort Liberty issues, and they have a lot more work to do, and it's quite embarrassing that a smaller town, why would you not? Hope County and Harnett County says, we believe in our people enough. This agency is representing Hope County. I've been a case manager. You can do 40 cases and get paid more and have 100 cases here in Fayetteville. So I'm talking about from the real groundwork. Right. I'm not talking about the paperwork work. I'm talking about for somebody who's been in the trenches. So I do thank you for what you're saying. And that's just, you know, it doesn't make sense why we keep waiting.
Yes, Commissioner Booth.
Thank you, sir. I'm just looking at the real world. The solution for whether it's 30, 60, or 90 days this way creates a much larger problem if we really look at it, that your 80 to 90s that are there right now, and they have been doing the double shifts and the double files and everything else, and their relief is making over $400,000 and is on call for a couple of office hours a week, or, you know, he gave you his personal cell phone number if something comes up. You know, I mean, are the people going to go visit at at his or her law firm's office? Or are they going to have an office here that they must report to? Or only if they've made an appointment do they have to come in? And at some point, I'm going to look down there and go, I'm sorry, I'm not here for Wonder Boy anymore. I'm making 90, and I've stuck it through the thick and thin, and he's making 400, and I know he left today at lunch to go to the mountains. You know, so that they're both going to leave, or 3, whatever you still have left there. As soon as they hear someone making 4 times what they're making on a part-time basis with no guarantee they have to take on a full caseload. You know, that it's hourly, and you know when you call them, that's the clock's running. They set up an appointment, the clock's running. So they haven't done anything, but the clock's running. And that's what I'm saying, is I would much rather trust the discretion of our county manager and you. And this board has not gone on the cheap, if we think lately, on what we've decided. We have quality people, we want to get them. We've paid quality dollars to get them. So we're not cheap as far as, once we're identify a need, identify a person we want to get, we have sat down in good faith in negotiations and tried to resolve those. And some we've been successful, and it's been great. Others maybe we haven't, but you know, this is I mean, it's not like giving somebody a full-time salary of 90 for part-time work. It's giving someone 5 times the full-time salary of someone that's already there for part-time work with no real guarantee as to what they got to, do they have to do a clock, the old Flintstone thing, clock in, clock out to justify the hours, or does their $157 an hour paralegal send you the bill over of what they said they did? So I don't know that it's actually in the real world going to help move the Smith, the Jones, the Adams, and the Booth family that's all on this wait list to have somebody that could be called and there could be an appointment. I'd rather give you 2 people at $110,000, $120,000 each, bump the other 3 or 4 that have stayed there to the $120,000, and spend my $500,000, $400,000 on that to get people there. They're going, damn right, they spent money on me. I've got an office. I got to show them that I'm worth this, and put them on, because once you become a county employee, it's not guaranteed for life. I mean, they'll still have to be reviewed by you and by, well, your successor and everything. So the money doesn't bother me. That's what I'm saying. It's not saying, well, these children aren't worth that amount and everything. I mean, I did juvenile court the first 10 years when I left the DA's office. That was back when we spanked kids. So I mean, it was the Stone Ages and everything. But so I mean, that's what I'm saying. I don't want to say that we're not playing big ball because we're bigger than someone else and we have the money, so let's just spend the money like that. I'm looking at like 6 months from now, we're going to be looking to replace the latest 3 that have left because of this deal where one person doesn't have any responsibility to report to anybody, is making almost $500,000. That's not a solution. That just means 2 or 3 more people go like, I'm out, what are you doing? Because when I leave, you're getting my files because he's never here. And they point to the empty chair, the empty office on the $400,000 guy or girl. So,
Yes, ma'am, a quick question.
Okay, Ms. Jackson, my question is to you, I guess, because usually when attorneys, I guess their staff, let's keep it real too, are going to help them, and I know someone from DSS works over there. When you checked out the references, just out of curiosity, they're handling this same company, or are they not handling, just out of curiosity, the Cumberland County, not Cumberland County, but are they not the representatives for Hope County? And when you checked out the references, I'm sure you had concerns. What kind of feedback did you have? Or are they, because I know there's concerns, people saying about calling up the hour. I'm saying, is this an agency that has other attorneys? And what was the response? I'm assuming that's why you felt to bring them aboard here. What was the response? What was the feedback when you called for references, since they're already representing some other agencies? I'm trying to figure that out. Were they good response or what?
Yes, the responses were positive. And
for these concerns.
And just like with any other contract, we have the fiscal responsibility to monitor the billing, to make sure that it's valid and those kinds of things. But yes, to answer your question, we did receive positive feedback from the county in which they work.
And I just asked that since you're already behind. I guess my concern is people that have DSS from working there. This type of representation is not like, it's just a different type of field of work, which is probably why a lot of people didn't fill out the application.
So that is a challenge not only for our attorneys but for our social workers. We do not get credit when it comes to caseload size and things like that because of the fact that we work very closely with Fort Liberty, and that happens with attorneys, social workers as well, in terms of when you look at the workload in Cumberland compared to other counties.
Well, we've got an MOU with them. We entered into an agreement, and we decided to do that. I mean, now we can always stop the MOU and let Fort Liberty take care of their own stuff. It's not feasible, but I mean, we do have an MOU, so I mean, it's not in stone. So when we talk about doing the extra work, we agreed to do that through that MOU. Through I think it's just easier to do that way.
So it's actually a Department of Defense agreement with the governor's office, not just for Cumberland County, but all counties where there are military installations.
That's right. Commissioner Booth.
We could banter about this forever. So to get it out there for some action, and again, listen to the way I'm doing this is, at this time, I move that we do not contract this contract under these terms for outside attorney services for DSS at this time. Now, that's what I'm saying. This one doesn't do it for me because it doesn't solve anything.
Well, I think you got to go a little bit further because she's got to need some help. So would you add to that we then look to see about using the attorneys in the county attorney's office to fill that gap? Along with, I think Commissioner Council was asking the manager to bring back a plan to be able to do that. And if you include all of that in there.
Well, that's what I'm saying. I didn't know to what extent it would be, so I just was going to deal with the contract.
He could go with the 6 to 9 months.
All right.
We may not need that according to what the plan is.
Did we not approve this contract?
Let's just say 3 months, okay?
All right, 3.
In 30 hours, yeah.
Yeah, but we need to do something, and the increase in the salaries, and I think the manager said that he could help with those salaries.
We're going to shift the burnout from DSS to my office.
Yeah, there you go. You stole them from her, so it's fair. You shouldn't have stolen them, so that's what happens. If I get a second.
It's your fault.
All right, it's been moved in second. All those in favor?
Excuse me.
Oh, I'm sorry.
Yeah, discussion on the motion,
Yes.
please, sir.
I'm sorry.
Okay, I'm not clear exactly what we're doing, okay? I understand the motion, but how does that affect the agenda for our next meeting? That's what we're about.
Well, this wouldn't go to the, well, I guess you might need to do a couple of, you might be right, you might need to separate this up and do the first motion that he did, and then do the second motion to bring, to do the county attorney's office. The salaries have already been done. So do your first motion, which is, I think the first motion.
To deny this contract at this time for outside attorney services for DSS as presented. To deny it.
And you got a second. All right. There's a motion on the table. All those in favor?
I thought we were asking the mayor.
Wait a minute. He's going to come back. This is just to stop this one, and then the next motion is for him to bring that back.
Okay.
All right.
Commissioner Stewart, are you on the line?
What?
Yeah. What is your vote?
Yeah, we heard you for a minute.
I'm again.
Okay.
She's what?
So you got 1, 2, 3, 4 for the motion, and I guess you against the motion. 5 to 2.
5 to 2.
Okay. So now do the next motion.
Okay, and that we
This is your
hear
motion.
back from our county manager at the 21st meeting, another alternative for this, and in the meantime, Ms. Jackson get with county attorney's office and work out an arrangement to do some staff sharing for up to 90 days.
Is there a second?
Second.
Okay, and to move it to a consent agenda, well, according to what the vote is.
Under the rules adopted for the conduct of agenda session, you wouldn't have to put anything on the regular session. This is a directive to management to come back.
All right. Thank you. So we don't need a motion.
And I have
Well,
a
you got a
question.
motion. You got the motion. It just doesn't go on the.
Then I have a question.
Doesn't go on the agenda. Yes, what's your motion?
I want to be clear
What's your
that, no, I just have a question. So
Yes.
then, after your office helps out in 90 days, are we just going to come out with another new announcement for full-time and a new salary? I don't even know what's going to
No,
happen.
did you listen to the motion? The motion was also a directive to the manager who's bringing back from Commissioner Council the alternative to be able to decide what to do. So
Okay,
it's
but
no,
that's
it's
what I
not to
mean.
kick it down the road.
Right, but I'm just saying, after 90 days, you're going to come up with some other options because your
Within-
office is only doing this for 90 days, correct?
Well, I mean,
He's
that's,
bringing it back
we're
to
just gonna start.
21st.
We'll start with that.
That's what I need to know. So then you'll be bringing back some new proposals?
The manager will be.
Right, that's what I was
By the
asking.
21st.
Yeah, I'll bring
this
it
month.
by the 21st.
Okay, thank you.
And to clarify the board's intent, because this is a broader issue than just DSS, I would ask that you have the manager look at not the child support attorneys and
Well,
my
I think
office, if that's what everybody understands.
It's the whole, my whole thing was the whole attorney, actually the executive, of, even the professional staff and, the senior staff, all of that. I think we just, at some point, we're going to have to sit down and have a policy thing on how we're going to deal with, some of this shouldn't be in HR. I don't believe that all of these attorney positions should be coming out of HR because these are professional things that have to be set at a different rate and a different level. That's just one person speaking, but I think that these are different than if you're talking about, because if you got to go through the same thing, to hire an attorney that I got to do, I ain't going to get anybody in the department without being in trouble, but any other position, that's just not the way we should be doing business. And so I think this board has to make that, whether we have to do a policy change and the manager can get us to that point. So that's the motion on the table. All of those in favor of the motion?
Commissioner Stewart?
You got Commissioner Stewart. Are you yay or nay on that motion?
Yes.
Okay. That's unanimous. She raised her hand on that. All right. Thank you. And I know you're standing up there to do that, but if you can give me a moment and let me go to the Piedmont Natural Gas one right quick, because Mr. Van Giens has to leave, and that's Rick. So if we can go to E, which is the Piedmont Natural Gas request. You can just sit right there in that chair, Brenda, because I'm going to come right back to you. The Piedmont Natural Gas request for the landfill.
Can you pull up the GIS map? Just when you did it before, just had you go to Technology Drive.
Oh, I could have done Brenda's by now then. The ARPA money is out there too.
Is that enough time for him? So what? Okay, great. What is that?
Okay.
And just in case, this is one we've already, on this Piedmont Natural Gas, Rick has gone over this with us, and I think Mr. Van Giens talked to us a little bit about where we're talking about moving this, so I don't know if there's any real objection to this. And so,
I would just share that what
this microphone right here.
I would just share that what I brought to you in closed session would happen adjacent and north of this, so there would not be conflict between this and the other. They actually are just on the opposite side of shared property lines, so no objection moving forward.
Okay.
Fantastic.
Yeah.
Okay.
So that you-
Don't give me a motion. We won't understand Rick anywhere. Oh, I'm sorry. Was that one last thing? Come on.
We need those microphones.
Rick, I think everybody was in agreement with you if you just
Okay,
make the motion.
all right,
Tell them what the motion
sorry,
is.
I just
I
wanna
think
show you-
everybody was in agreement, Rick. You just need to go ahead and.
Piedmont, as Commissioner Adams said, Piedmont Natural Gas, you already heard this last fall. What they've come back with, and there's a plat of what they have proposed in your package. I was going to try to show it on GIS, but it's taking too long. But they, it's kind of messy because the GIS map showing the location of their existing regulator station is not correct. The location of it is not actually on their property. They have agreed to take the property that lies behind the City of Fayetteville's lot to square this up. And they have now acquired an access easement from Walmart to get to that track, and they're going to put everything in this. It's a much larger lot. It's 1.9 acres, but the way with all this stuff around it, it's not really usable for anything. I think this is really beneficial to the county's property. So they would have all their property. They've offered a price of $10,000 for that, which they calculated by dividing the tax value by the 159 acres that's in this tract. They also have agreed to stop using the dirt access road that crosses the county's, the 33-acre tract actually, to get to the regulator station. They have now a recorded easement from Walmart. I think I recommend it. I think it would be very beneficial to the property. Have you seen it, Robert?
So if we can make if I can get a motion to approve the P&G's proposed purchase of this property for the use for $10,000 by adopting the resolution that's attached.
So moved.
Second.
It's been moved and probably second. All those in favor? I think that's unanimous. And then we'll come back to the reallocation of the SNAP. This is the ARPA funds to, again, we talked about trying to keep people, if you looked at your report, I'm not trying to get you, Ms. Jackson, but this is to pay, to compensate those folks who've been working overtime, working hard. I will tell you that our numbers in foster care have gone down. They have worked hard. And so this is to use that money, because we couldn't use it in that last time because of time restraints, to identify this for those funds, and these are the SNAP ARPA funds, and put them in the budget. If I can get a motion.
So moved.
Second.
It's been moved and second. We'll move this to the consent agenda. All of those in favor?
Unanimous.
All right, thank you.
And Commissioner, if I could, I just want to say thank you for all of the discussion and all the efforts to help us address our issues. It is so much appreciated. These are tough decisions, and we understand that, but I just want you to know we do appreciate it.
Yeah, and that's what I'm saying. Tell them thanks. That's what I'm saying. That's the kind of money I'd like to spend. You know, thanks for hanging through the tough times.
All right, thank you. Have a good day.
All right. That takes us to our animal medical fund ordinance. You saw that, and if you look on it, you'll see the red that changed it. That committee actually hadn't met in a while in terms of talking to the finance director. I think she's looked at this. And so the changes are in red, which is basically to create the animal services, the director, the veterinarian, and the assistant county manager over that department to be able to use these funds. And at one point it was up to $27,000, but because they hadn't met, they hadn't used it. So this is beneficial for all of those injured animals here in Cumberland County. If I can get a motion to adjust that ordinance.
That's my motion, Mr. Chairman.
Second.
Is there a second? All right, it's been moved and second. All those in favor?
Unanimous.
Thank you. That will take, and that will move to the consent agenda. That will take us to D. We're on D, the North Carolina Department of Transportation request for entry agreement to commence work.
Mr. Vice Chairman, Amanda Bonner's here. She's the solid waste director. She and I both have worked on this and are recommending it. We're not recommending the entry agreement, but we have a recommendation. DOT is doing a widening of Camden Road, and it is going. They are basically going to take at some point, all of the Camden Road Convenience Center.
How much they offering us for?
We're not there yet. Okay.
Because I'll go hire my attorney so we and sue DOT for commendation.
But that's what. But here's the.
I got you.
They provided a standard entry agreement just to supposedly move the. Start moving utilities, but the way it reads, they can just commence work. And even though this thing's a half acre, it's a triangle shape. It's not a lot as usual, and it's Amanda's, in my opinion, both that it would be risky to continue.
Wouldn't they have to do a condemnation? They just gonna come in and commence work?
No, they were asking us as a given this. Just the entry agreement. And Amanda sent language I reviewed that was fine, that would have helped us. I mean, that would have enabled them to work, us to work together and keep the place secured when it's closed. But they've rejected that, so it looks like they just want to proceed. And what we're recommending is that you do not grant this agreement for entry and authorize solid waste director to commence the process to start seeking another place to relocate this, and dealing with DOT to try and get some money for it. Right. But that's the recommendation.
To deny the entry agreement.
Yes, and authorize the staff to proceed.
Look for a new site for the.
Yeah.
All right.
So moved, Mr. Vice Chair.
Is there a second?
Second.
It's been moved and second. All those in favor?
Unanimous.
That is unanimous. That takes us to other items, and I think for the competitive grants update, talked to the manager earlier. I think that's just for information. Oh.
Yeah, this is for information. If you may want to be in the report section.
Oh, he's bringing his sign. He's bringing his sign. Let's see this sign. You put, okay, let's see here.
Nice.
So, hopefully everyone can see I'm not away. I've been down. But we want wanted to show you all a prototype before we actually, I think.
Can we do this? Can you tap him and pull it, and bring it here? We'll be able to see it on the screen, and the people on the screen will be able to see it.
If my shoulder comes out.
Yeah, that's what we look. It came out the other day. Now I told you that's why I said Ty over there. You got to know your limitations. That's a young man.
Watch it.
Oh, I'm sorry. Okay, there you go.
So we wanted to let you all see a prototype before we actually start installing these. And so we brought, this is what the final product will look like. This is one that we'll install in all the 12 border, the boundaries of the county.
Okay. Looks nice.
All right. Anybody got any questions or comments?
No.
All right, but that looks pretty good. All righty. All right, so the other ones were your monthly reports. There is no closed session items, so I'll take a motion to adjourn.
So
I move to adjourn. Second.
It's been moved to second. All those in favor?
Unanimous.
That is unanimous. We are adjourned. Thank you, Commissioner Stewart. We pray your safe travels back to Cumberland County.